This clinic started as a small, very small clinic in 1996. It wasn't located here then, it was located in the town of Mateete. But it became this place, a hospital, since 2006. And been working with this hospital since then as managing director and also a medical officer. Initially, I started with 2 nurses, one midwife, 1 nurse in 1996, and I was the only doctor then, the only clinician, and since then we've expanded. It's a 50-bed capacity hospital at the moment, and so we do a lot of admissions as well. Now we are 2 doctors, 2 clinicians, we have 4 midwives, we have 10 nurses, we have other support staff. We, on average, we have about 60 to 100 patients per day. I think it's a very big mixture of all sorts of diseases, right from infections, and the commonest is malaria, and then we have chest infections, or respiratory tract infections, we would say medically. We've in the past received different volunteers. Between 2006 and 2011, we were getting some Swedish doctors, and these were many family doctors and physicians. They worked with us for some time, and then the program ended. And then recently we had a team of Spanish dentists and dentist surgeons, and they ran a camp for 2 weeks, and they all have been here. It was flooded, 200 patients a day, 150 a day, and we thought that was very good. At the moment, I'm the only one possible who can do surgery, and among the things we need volunteers, actually, I think, in surgery, even general medicine, and obstetrics. Yeah, because working alone, as you've seen me, I've been running up and down. I have to be called here and there, see every sorts of departments, which is not workable. Then I have to work 24 hours, 7 days a week. Yes, I think we need mainly equipment, because many of our facilities are not well equipped. Like the theater is very, very minimal. We lack a lot of instruments, a lot of furniture like beds. Our bed is very old. This hospital is open 24 hours, 7 days a week, and you will typically see a patient any time of the day. So typically we work from 8 o'clock. This clinic, the OPD clinic, outpatient clinic, works then, and then closes 8 p.m. And then there are nurses who then go on call, and the doctor also remains on call throughout the whole night, seeing patients as when they come. So it's a full-time kind of setting. So foremost, I should say this is the biggest health facility in the whole of district of Sembabule. So all facilities in Sembabule do refer their patients here. Those who have failed to deliver, those who need blood, those who need to be admitted, they all come here. And when this can't be done here, then the patients must move to Masaka, which is about 45, 50 kilometers from here. A very long way and very bad roads, as you have seen, if you have moved on that road. And of course also at night especially, the means of transport are very poor because the vehicles aren't moving.
Do you have an ambulance for doing that traject?
No, we don't. People always have to go with private cars. It has been malaria. Ever since we started, many of the years has been malaria. But because of the interventions by government, by providing mosquito nets and other treatment, I think chest infections are taking over. Yes, chest infections, the pneumonias and the upper respiratory tract diseases. I'm seeing a trend. They are going higher than the malaria. Many patients will have to pay something because many of the drugs we have to buy them, almost all the drugs. But people with tuberculosis, people with HIV, those get free services because people for blood transfusion, that's a free service. People for family planning, that is a free service because like those drugs are sponsored to us by government. So they always get those services free of charge. So about 5 services that you will get free of charge, but otherwise the others they have to pay. Oh yes, I think to be sincere, if you are looking for money, you don't become a medical doctor, because I think it's a calling and you must serve everybody, whether they have the money or not. For example, we do lots of surgeries. People are being referred here because they have failed to deliver. And many of them, once they deliver, they say they don't have the money. And you can't say, pay before I take you to theater. And you have operated them and they say they don't have the money. Try to keep them 1, 2, 3, 4 days. You need the bed, so you let them go, and many of them will not come back to pay you. Not in any other business can you get that. You can't go to a shop and pick a piece of clothes and you go with it. So, but it's possible. You can come and access services and you walk away, and we can't imprison you. So I think our profession is much more different than other professions, and we always say never put money first, life first, money next.